Okay. Everyone, this is Colleen Mecca, and she is in the FNP track here at Baylor. She holds a BSN from UT Tyler. With over 8 years of nursing experience, her background spans primarily in the medical and neuro ICU and PACU. During the height of the pandemic, she became a travel nurse working in COVID ICUs, both in New York and Texas for 2 years. She is super certified BLS, ACLS, and NIH stroke scale. She currently serves as a home infusion therapy nurse and resides in Austin, Texas with her husband, their 2 dogs, and recently welcomed her first daughter in March of this year. Without further delay, Colleen will now present her DNP project titled Building Better Habits, a DNP project leveraging SMART goals and the lifestyle assessment short form in patients using GLP-1 agonists and Phentermine. Colleen?
All right, thank you so much. Okay, let me just make sure I can. Okay, are you able to see it okay?
We can.
Perfect. All right, so I'll just jump right into it. Thank you so much for that introduction. Okay, so the purpose and project type. So I had a quality improvement project, and my purpose was to improve lifestyle habits with behavioral changes. And I did this by utilizing goal setting and tracking. Specifically, I used the SMART acronym for goals. So they're specific, measurable, attainable, relevant, and timely. And I also wanted to utilize mHealth technology like MyFitnessPal to really help with the adherence of these goals for patients. And I assessed any behavioral changes with the Validated Lifestyle Assessment Short Form, also known as the LASF, from the American College of Lifestyle Medicine. And in order for me to use the LASF, I did need to become a member, which I attained last year in December. Okay, so just a little recap again. So specific, measurable, achievable, relevant, and time-bound goals. And so an example I might work on for a goal with a patient might be, I will walk for 30 minutes, 5 days a week for the next 4 weeks to help increase my daily physical activity. And these were the types of goals that we really tried working on with patients, more centered around lifestyle. And the LASF really helped kind of pinpoint those specific barriers. Okay, so here's my problem identification, background, and significance. So obesity impacts nearly 40% of US adults and plays a major role in chronic conditions like diabetes, heart disease, and hypertension. And at my clinic, I noticed a growing number of patients relying heavily on pharmacologic options, especially GLP-1 agonists that we all hear about, and phentermine. So GLP-1s mimic the body's natural hormone to help lower blood sugar and slow gastric emptying, and it increases insulin and reduces appetite. All in all, it really is great at losing weight, and it's very effective. However, it does come with some challenges, such as it's very expensive, there's insurance barriers, and there is a need for consistent long-term use. And a little bit about phentermine is it's a prescription stimulant medication, and it's usually best for short-term medication use, and it helps suppress appetite to promote weight loss in patients. And there were other weight loss medications, but these were the 2 most commonly used. And a common pattern that stood out at my clinic was how often patients regained their weight after stopping their medications. And during my literature review, I found this was also common. So in addition, several studies also emphasized that cardiometabolic improvements also tended to reverse when semaglutide is stopped. So this reinforces the idea that obesity is a chronic condition. And this is where SMART goals and mHealth tools come in. And research does show that SMART goal setting can help patients stay focused and improve adherence to behavior change. And then tools like MyFitnessPal can enhance motivation and self-monitoring. And this has been shown to improve both weight loss and long-term positive change in lifestyle habits. So this is my review of evidence. The PICO question I had was, will weight loss clinic utilization of SMART goals focused on lifestyle improvements in MyFitnessPal in patients using GLP-1 agonists or phentermine for weight loss improve lifestyle factors in adults ages 18 and above over a 90-day period? And below you can kind of see the common themes of the literature review. I ended up reviewing 148 articles. There's a lot of stuff out there on this. And through that, I noticed a few key patterns. So like with my own observations at the clinic, patients often regain weight after stopping medications if lifestyle changes are not in place. And I found that SMART goals can help patients stay structured and accountable, and they are more likely to maintain healthy habits if we have these type of goals in place. And then again, the mHealth tools like MyFitnessPal could also help boost engagement and motivation by making tracking easier. Another find was there's often a gap in behavioral help, support from providers during weight loss pharmacotherapies. And so overall, the research does support that combining medication with behavioral strategies can help maintain weight loss long term. And I'm so sorry, it started storming, so I hope it's not interrupting this. So for my study population, this was conducted at an outpatient weight loss clinic in Central Texas. And the populations were adults ages 18 and above with a BMI over 25, and primarily they were using GLP-1s or Phentermine. For my needs assessment, the internal evidence from reviewing patient charts at the clinic and my own observations during patient appointments with the provider did show there was a lack of structured support of lifestyle changes. And I really wanted this project to have the potential to improve this and help develop strategies with patients to keep their weight off, even after stopping their weight loss medicine. Okay. Below are the translational frameworks and the quality theoretical model that I used. So for my framework used, it was the Plan, Do, Study, Act cycle. And this just supports continuous improvement by planning the intervention, implementing it, then studying the outcomes, and adjusting based on feedback. So this really just ensured that we implemented the project, and I was able to adjust things as needed just to help clinic workflow. And the self-determination theory that I used was a really great fit for my project because it emphasizes intrinsic motivation. So doing something because it feels personally meaningful. And I wanted to help patients identify what they truly valued by improving their health and pinpoint their barriers. So for instance, an extrinsically motivated goal would be, I want to lose weight and look better for an event. Whereas an intrinsically motivated goal might be, I want to feel more energized and confident day to day. So motivation was also assessed at the end of the LASF, where patients were selecting their top motivators like nutrition, physical activity, sleep, mental health, and so forth. And so this kind of helped guide the goal setting process, and it also aligned perfectly with the project's aim to support lasting lifestyle changes. All right, so for IRB, clinic site IRB was not indicated, but I did get approval from Baylor. And I did obtain clinic leadership site approval with an MOU signed by the owner and the APRN. And for ethical considerations, no patient identifiers were used, only demographics such as age, gender, and race, and everything was voluntary. So it was a simple yes or no if patients would like to participate after explaining them what the project was. All right, so here's the intervention implementation. Those involved in the project was myself, the nurse practitioner, and 2 medical assistants. On the right-hand side, you can see the front page of the validated tool utilized, which was that LASF form. And then my timeline was from January 18th to April 18th, and it was a 90-day period. And to prepare, staff were trained during a lunch and learn that I conducted, where we reviewed goal setting, informed distribution, and what our overall aim was of the project, including lifestyle change. And so to ensure that they understood the aim of the project, I did create pre and post tests, and everyone did great on those, and so they all understood the overall goal. A little bit more about the implementation process. So on the right-hand side, it's a section of the SMART goal tracking form I created, and I'm reusing that goal example I said earlier, and this is kind of how it might look if it was filled out. So for the first visit, patients were handed an LASF from the medical assistants while being groomed, and the provider would come in and discuss about 2 to 3 goals, which were created collaboratively with the patients. And this was done just at the initial consult between the provider or even sometimes myself, as this was an old clinical site that I was at, so I knew the clinic workflow. And during this time, we would also provide education on MyFitnessPal for tracking, and then patients would agree to download it or not. And then for every follow-up visit, we just collected another LASF and then had the patient self-assess their goal adherence to this tracking form that you see here. And if there were any concerns or barriers, we would address them then. And you can kind of see how it's filled out. So for goal 1, you would just put the week and you would circle how often you felt like you adhered to it. And then if you had another goal, you could do that and so forth. And it was just a nice way to easily see how well people were adhering to these goals. All right, so below are my outcomes and objectives. For the project objectives, for the first one, I really wanted to achieve an 80% completion of the LASF among all new and eligible patients that were offered one. The second objective was I was hoping to get about 70% of those patients to set about 2 to 3 SMART goals, focus on lifestyle changes. And then objective 3, I was hoping of those people, we would also get 70% of patients to download and begin using MyFitnessPal. And then for my final objective, I was really hoping to see a 20% improvement in overall LASF scores from patients' baseline LASF to the final one that we got from them. And the way that I collected data was it was in person. I went in there and entered the results into Excel. I just took the LASF scores, the goal tracking sheets, and I only captured demographics. And then, of course, confidentiality was very important. So I made sure to de-identify all patient data using random alphanumerical ID numbers such as A2, B1, E5, and so forth. And then all the physical forms stored were stored securely in a locked cabinet behind the receptionist desk, and only myself, the site APRN, and the medical assistants had access. Okay, so for the first project objective, like I said earlier, I was hoping to get at least 80% of people offered an LASF to complete one, and we definitely achieved that. So amongst all the 38 participants of this project, 100% completed one, so that was great. My second project objective was to get 70% of patients to set about 2 to 3 goals, focus on lifestyle change, and of those 38, every single one completed at least 2, so that was also great. The third objective, I was hoping for 70% of patients involved to begin using MyFitnessPal, but we only had about 11 out of 38 agree to download it, so about 29%. A lot of people didn't seem that interested, unfortunately, adding another app onto their phone. And then for my fourth and final objective, the aim was for a 20% overall improvement in LASF scores from the baseline to the final. And of those 38 participants, about only 18 had an initial and final score, unfortunately. So I could only use these 18, but of those 18, 15 had a positive increase, and the average increase was about 13.64%. And the reason being, and I'll get into this a little more later, was we just didn't have a lot of follow-up visits given their LASF, and so I didn't have complete data, unfortunately. Okay, so for my data analysis methodology, I use the Wilcoxon-Stein rank test to assess pre and post intervention changes in the LASF scores. And then in addition, I also used a standardized sum of scores to assess for 7 lifestyle domains on the LASF, which I'll again explain a little bit more later on a different slide. The statistical software I used was Python version 3.9.6. And again, out of the 38 participants, I could only use 18. And here is just kind of a chart showing the demographics of the participants in the project. I wouldn't say this is an overall representation of the clinic, but it's close. So you can kind of see here the ages were usually below 30, 31 to 50, and 51 and above, so they were pretty even. Ethnicity mostly white, followed by Hispanic and African American, and the majority were female participants. And then these are the LASF results with the Wilcoxon rank sum. So again, this was used to evaluate pre and post intervention changes across all LASF lifestyle domains. Among the 38 participants, the final pair sample was 18. And significant improvements were found in 3 areas that you can see highlighted. So there was a 20% improvement in weight perception. So how people felt about their overall weight, was it positive or negative? And most felt more positive. There was a 57.9% decrease in feelings of disconnection and a 61.5% decrease in reported worrying. These results do suggest that perhaps after the intervention, maybe patients felt better about their weight and had stronger social support and just reported less worry. And then while not significant, there were other areas that did show some positive trends, including an 18.75% increase in fruit and vegetable intake, and then an 11.9% increase in exercise days. And while these are not statistically significant, likely due to the small sample size, overall the results did indicate some meaningful change and lifestyle improvements. And the reason I used the Wilcoxon test was it's a non-parametric, which just means it doesn't require normal distribution. And it's really great for small sample sizes like my own and ordinal survey data like the LASF. And it's also designed for paired data, which does fit our goal of comparing patient scores before and after an intervention. Okay, so this is kind of a what if scenario. So what if all 38 participants had completed both an initial and final LASF? I created here a hypothetical scenario, just doubling the responses and assuming similar trends in the patient responses. And you can see here, based on that, we would of course see even stronger statistical significance in the areas that we already discussed, plus those borderline areas like the fruit and vegetable intake and the exercise days, and those might have reached significance too. And so this really did highlight for me just how much the small sample size kind of impacted to our ability to detect meaningful change. And so I just wanted to throw this in here to kind of show, like, what if more of those patients we got follow-ups. All right, so here is the standardized sum of scores. So again, due to the small sample size, I wanted to try and pull as much info as I could from the data I had. And this is why I included this. And a standardized score, or also known as a Z-score, just indicates how far away a particular data point is from the mean. And this is measured in terms of standard deviations. And it allows for a comparison of scores from different distributions with different means and standard deviations by placing them all on a common scale. So all this to say, a positive Z-score just indicates the raw score is above the mean, and then a negative Z-score indicates the raw score is below the mean. And so for this standardized sum of scores, I just tested the initial 7 lifestyle domains on the front of the page, and because those were the most filled out. And as you can see here, of those 18 that I had, 15 showed significant improvements. And this was confirmed by a paired t-test that you can see on the right-hand side. These tested lifestyle factors, including hours of sleep, again, their weight perception, how much fruit and vegetable intake and nutrition, and then how often they're going to the gym and maybe for how long. And we assumed here, of course, when I did this, that all 7 questions on the LASF did hold equal weight in their lifestyle improvement metrics. I wanted to point that out just so I could do this standardized sum of scores. So an example here of a really great before and after. So for patient A5, they had a 14 baseline score, and their final score was 23. So that really did show a significant improvement. And then the grayed out areas were either there wasn't any change, like for example, this guy here, or there was a drop, unfortunately, like this person here. All right, strengths and limitations. So for the strengths of this project, there was 100% participation in the LASF and SMART goals during initial implementation. And then those improvements I mentioned earlier, like weight perception and nutrition, those did really great, and I saw a good improvement there. I also saw positive trends in fruit, vegetable intake and exercise and junk food reduction. And then something that was really nice to just see throughout this project was we had a lot of positive verbal feedback from patients, just saying how much they really appreciated us taking the time to just kind of sift through their barriers and figure out what's getting in the way of their health goals. For limitations, there was a mid-project provider change, so that kind of led to some reduced engagement. A new provider did come on, and I was able to obtain a new MOU. MAs would also sometimes forget to just distribute forms. And then, like I mentioned earlier, that staff turnover just kind of impacted the consistency a little bit, even though I was checking in and trying to educate along the way. So that kind of affected how often the final distribution of forms got distributed. And then, of course, my valuable takeaway as a project leader, all this, lack of consistency really showed to me the importance of consistency and having a clear workflow and just how critical that is for the overall project success. All right, so below are my recommendations for practice. So I wanted to emphasize the importance of lifestyle habit discussions. I feel like we don't do that enough. And this project really demonstrated that when we take the time to have structured conversations about lifestyle habits, people really are receptive to that. And if we pair those conversations with SMART goal setting, we can see improvements in how patients think about their health and the behaviors they choose. And as APRNs, it's essential that lifestyle counseling becomes a routine part of our visits, particularly those who are often prescribed weight loss medications because they don't have those structured lifestyle behavior counseling. And we know that these habits can impact not just one part of our health, but every aspect of our health. So it's very important. And one strategy that we could consider is scheduling dedicated appointments that focus just solely on lifestyle counseling to allow enough time to address barriers thoroughly. The other thing I'd recommend is to use the lifestyle assessment short form as a clinical tool. And it's a valuable way to pinpoint patient-specific areas of weakness, whether that's nutrition, sleep, or lack thereof, and then physical activity and so forth. And it provides a great foundation for personalized goal setting. And then I would also integrate SMART goal setting into the initial consults if you're going to implement this. So during an initial consult, set aside time to help patients identify and commit to one or two achievable lifestyle goals. And again, a structured approach can increase the accountability and motivation, both of which were strongly supported by the outcomes of this project. And SMART goals can make expectations clear and progress measurable for these people. So it kind of makes them feel more empowered and more involved in their health. And then another recommendation would be maybe refer patients with complex barriers to appropriate support. So if we're encountering a patient who has issues like perhaps emotional eating, low health literacy, or possible food insecurity, I would consider referring them to the right resources, such as social workers or nutritionists, or even behavioral health providers as well. Okay, and then during this project, we focused on making the process sustainable by sharing responsibility among the staff. For example, the medical assistants helped by handing out the forms and having the patients fill them out before the provider came into the room. And this kept the LASF forms also visible, which was a great cue to remind the providers to go over goal setting with them. And then while my original target was to set 2 to 3, in reality, I think most patients would prefer 1 to 2 based off feedback I got. And so even so, this goal setting approach really seemed to boost satisfaction and retention for these patients. And many just shared that they, again, appreciated having a structured way to kind of track their goals. One issue that did come up often was having the medical assistants, they'd forget to distribute the forms. So to help with this, I'd also suggest maybe adding appointment reminders in the clinic scheduling system. So it becomes part of the workflow. And it's already there and reminding them because they look at it every day. And then also to avoid overwhelming patients and staff, it might be better to limit the LASF completion to like once a quarter instead of every follow-up. And since the clinic volume can be a little unpredictable, I'd also recommend scheduling dedicated appointments or using slower weekdays specifically for initial goal setting visits, rather than trying to squeeze this into routine appointments. And I feel these recommendations would really add to the sustainability and really integrate well into the clinic's overall workflow. And for acknowledgements, I'd like to really thank my husband. He's been my biggest supporter throughout this whole entire program. And he was actually the one that encouraged me to get my doctorate. And he also lended his expertise in with the statistical analysis. He's a data scientist, so this is his bread and butter. And then I'm also very thankful for my parents for their constant support during my education. And they always have my back when I need it. And then, of course, I want to acknowledge my biggest ray of sunshine, my daughter, whom my husband and I welcomed in March of this year. And she was my little clinicals buddy for a couple of semesters. So I want to acknowledge her as well. And thank you all for joining in and listening. And that is the final bit of my project.
Thank you, Colleen. Open the floor to questions, comments for her.
Sure, I'll go first. Congratulations, Colleen. Great job on this project. It's very timely. Definitely something we see in the office so frequently, the weight loss and GLP-1s and Phentermine and all of the above. I really love how you made this project more holistic in terms of looking at just lifestyle as a whole. It wasn't just about weight loss. It wasn't, just about a number on a scale or a BMI or something like that. Yes, of course, we want patients to meet certain goals like that, but really looking at those barriers and trying to figure out how we can help them meet those goals emotionally and spiritually as well is just so important. So I just commend you on the project. I think you did a great job, and congrats on being done with this part of your DNP project.
Yeah, thank you so much. I appreciate that. Any other questions?
I just want to say you did a great job. I think for us on the clinical side, it's always nice to remind patients to have SMART goals that are kind of realistic. I mean, everybody wants to lose that 40 pounds before they go on their next vacation, but that's not really realistic. And then just kind of remembering, it's like, yes, you lost the weight loss, but how are you going to continue that weight loss? So yours was very holistic. I do like your data. It's nice. I don't think everybody uses the app, but that would have been a nice thing for patients to integrate with. But your information was really valuable. Congratulations.
Thank you. Yes. I really did want to make it more holistic. I feel like, unfortunately, that can get neglected or put on the back burner sometimes. So it's just sometimes the basic, like being healthy and addressing root cause problems, I felt like was missing in a lot of these new pop-up weight loss clinics. People want an easy fix, and we have that kind of now, but it's temporary from what we can see.
One question I guess I do have, you mentioned the lifestyle assessment short form. You had to join an organization or something to be able to get that. What was the cost so that, if all of us wanted to join that or to be able to download and use that tool?
Yeah, if I remember correctly, I think it was about, I want to say like $112. Okay. A little pricey, but once you become a member, they actually have access to all sorts of validated tools. And I got to sign up to their newsletter, and they give me tons of access to holistic updates and things like that. So if you wanted to lean into that, I actually found that to be a really great membership to be a part of.
Yeah, and what was the organization name? Who did you get that through?
They were from the American College of Lifestyle Medicine.
Okay. Thank you.
Mm-hmm.
Any other questions or comments? Okay. Thank you, everyone, for coming and supporting Colleen and just sharing your time with us today. We really appreciate it.
Yes, thank you, guys.
Happy 4th. See you guys later.
Take care, everyone.
Thank you.